The following segment is paid for by Holston Medical Group.
Statistics show about 1 in every 8 couples in the U.S. experiences infertility. That means these couples have been trying to conceive a child for 1 year. It's a process that can be frustrating and heartbreaking. In tonight's Health Matters by Holston Medical Group, we learn about different tests and treatments that can help.
It's one of the most precious gifts, but getting to this point is not always easy. And especially for women, having trouble getting pregnant can take an emotional toll.
I think when a woman receives a diagnosis of infertility, this can impact her with a negative impact. They may have feelings of anxiety, of stress, of guilt or shame, even a sense of isolation. This can obviously affect their psychological as well as their emotional and spiritual health. This is what can drive a wedge in those relationships with their partners, but also their close family and friends.
There are several causes of infertility. For women, it could be hormonal imbalances, structural issues, or their age.
Peak fertility is at age 25, but it naturally declines at the age of 35 years, and that's mainly due to a decreased production of eggs or the quality of the eggs. And then the fourth component is usually just that a woman needs extra education. This is for women who may not be tracking ovulation or their periods, and obviously if they're not having regular cycles or if they're missing cycles, they're going to have trouble conceiving.
Hoover also says male issues account for about 30% of the cases of infertility, and that's why testing is important for both men and women.
We're going to review their medical history and then perform a physical exam. We're going to offer them a hormonal lab panel and then definitely do an ultrasound to assess some of those structural issues like the uterus and their ovaries. We may refer them for specialized imaging. That's going to look to see if their fallopian tubes are blocked. But testing for men is equally as important. A semen analysis, that's going to tell the sperm count, the motility, but also the health or morphology of the sperm.
Testing and treatment can take time. Hoover urges couples to communicate, ask questions, and look for those who can offer support.
We want to raise awareness and promote self-advocacy, but also encourage communication about fertility. We want our patients to feel empowered, that they can have these conversations with us as their provider. Social media has both positives and negatives, and I really admire the vulnerability of women who can share their stories of success and write about their journeys through infertility, and I think this opens the dialogue for other women to feel more confident and comfortable in having these conversations, but also that's going to instill some encouragement and hope for them to have a successful journey as well.
Hoover also encourages those struggling with infertility to reach out to their healthcare provider. Take that first step. For more information on infertility, please check out the Health Matters blog by visiting holstonmedicalgroup.com.